Hey, good morning. It's Wednesday, April the 27th. Thank you for joining us here on Facebook, YouTube, and Twitter. This is Open Mics with me, Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dall Simons Family Studio. Art and ethics converge in the crossroads this morning as we take you live to an art studio to answer the question, what do you wish for? We'll meet the artists and learn how their work is supporting the Center for Practical Bioethics. Get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You'll find those links right here on your screen. We have a lot to talk about today, and joining us in the studio is John Carney, President and CEO of the Center for Practical Bioethics. This artwork we're about to share is all about supporting the center. Explain, John, what the center does, how it got started, because I think there will be folks out there who don't really know. We'll talk more about ethics in a minute, but let's get to the artwork. So, John.
Thanks, Steve. It's great to be here.
Thank you for coming back. Yeah, it's awesome to have you.
Wonderful to be here. So, well, I guess the best way to explain the work of the center is, about 40 years ago, a doctor and a lawyer and a philosopher walked into a hospital.
Oh yeah. This is like going to the bar. I get it now.
That's right. Okay. That's right. So, and actually, it's not so far from the truth. Right here in this hospital is really where we got our start. One of the attorneys was up in the rooms working with a lawyer and another lawyer and a judge taking a deposition on somebody who wanted to come off a vent. And she shook her head and she said, "This is absolutely nuts. We've got to do something about it." And so she worked with a physician and a philosopher ethicist from UMKC, and that's what gave us birth. So we've been around about 40 years, and bioethics is kind of a highfalutin term, but I think what we decided to do right here in Kansas City was to make it real for people, and that's really been what we've been doing for 40 years, almost 40 years now.
You guys have done a great job of it, just to say. I mean, my wife is on the board of the Center for Practical Bioethics, and I've been involved with y'all for a long time, and it's a great organization, I think, just a great organization, and does such great work. And you guys aren't, your bioethics spans more than, certainly about life and death and end of life care and making your wish about how you want to pass away. But sometimes you involve and get into the art world a little bit.
That's right.
How did that venture take place, John?
Well, it started with actually a visit to Hallmark. We do advanced care planning with them. They're one of our organizations that hires us to help them with their employees in a wellness program. And we were over there, and we were leaving, and somebody said to us, "You need to go see the show." And so we ended up going back into the studio and saw the artwork from Marn and Andy and absolutely fell in love with it. And it was really about how people who are, in many cases, not heard, their wishes are not heeded. We haven't paid much attention to them, and we've all suffered that over the course of the last couple of years. And we just fell in love with this art. You're going to hear more about it from them today. I don't want to steal their thunder, but that really kind of gave us a way for us to express in art, and another way for us to express the work that we do by connecting with people in a very different way. So we've always kind of seen ourselves in the area of performing arts, and ethics gets displayed in a lot of different ways. So we've really enjoyed the relationship with them. It's been going on now for about 3 years. So
yeah, it's a big deal, I think, and I've had the pleasure of and privilege of having seen this. But so let's head out to the Lady Volkus Art Center, the Crossroads, with artists Andy Newcombe and Marn Jensen, who are going to show us some of the art, what it means, and tell us a story. Andy and Marn, good morning. Quickly, so some of the artwork, talk to us a little bit about it. Who created that artwork?
Actually, we both did. We collaborated some with other artists, but mostly it's the work of our two hands and hearts.
Yeah, and it is a stunning story that is told, I think, having been able to see that. Talk about some of the pieces and about how long it took to kind of create each one. Tell us a story. The art of the wish, what does that mean?
Well, we interviewed about 200 elders, and we went across the country and just had conversations with these people. And really, we would start, and I would just say, or Marn would say, tell us about yourself, tell us your life story. And we would just ask an open-ended question, and the people that we interviewed would begin talking to us, and they were very forthright, and they would tell us their most heartfelt experiences. And I felt like they were really just thrilled to have somebody that was willing to listen to them. And Marta and I left every single conversation that we had, and we were overwhelmed with the experience. And we always left feeling like we gained so much from those conversations.
Yeah, it was really a gift to us, for sure.
So then when we had the conversations, we felt like, well, the wishes that we pulled from that time, we need to really do something with that. We need to create something that will artistically represent their wishes, hopefully in a poignant way. And so here in the studio, we have about 70 of those wishes that we have created artwork for. We wanted to do artwork for all of them, but we have about 70 here, and we've been working on it for a little over 4 years.
That is really cool. How long did it take to create each one of these works of art?
A whole range, right?
Yeah.
We've started in late 2017, and everybody, this is a question that we get asked a lot, like once you had the wishes, how did you think about the artwork? I mean, wasn't that so hard? And for us, that's the easy part.
Right.
The ideas just wouldn't turn off, and it was coming from such an emotional place. And as artists, we just wanted to bring these wishes out to the world from these voices that aren't always heard in this different medium. So for us, it was a great challenge. So fun.
And I would say too that some of the pieces were quick, but then there were some, I'll take you over here to one, that took months. This piece that I did over here is 8 foot by 8 foot, and it is all hand knotted, thousands of knots that were created with clothesline. And this is a tribute to all of the women that we interviewed who were in their 80s and 90s, and really a tribute to the chores, the mundane chores that they did through their life. And that's why I did it with clothesline. What were they thinking of? What were they wishing for, hoping for, praying for while they were doing these mundane chores? And so this one took months to do. If you turn around over here to this paper quilt, these are all cards and letters that came from one family from 1901 to 1989. And this one, which is 16 feet long, also took several months to do. So to answer your question in a very long way, some of them took a lot of time, and then other ones came together very quickly.
Yeah, that is remarkable. Well, listen, stand by for us. We're going to take a look at all the artwork in about 20 minutes. And I'll just to say to our audience again, these artists were inspired to ask 200 seniors one question: what do you wish for? And then they took that and converted it into art. We'll be back to talk with them in just a moment. John, I want to turn back to you now. I want to start with COVID and the impact it has had on your work with your team and the work that your team does. How has a pandemic complicated ethics in healthcare? And trust me, I know that it's complicated ethics, but I'm curious to hear your thoughts. So there have been lots of opinions during the pandemic about what might have been right or wrong, good or bad. Help us understand a little bit.
Yeah, I think, Steve, I'm not sure I'd really think about it in a way of complicating ethics. I think what it's really done is revealed a lot about the need that we have to do a better job of taking care of people who are vulnerable, who need our help. And our health system is not particularly good at that. We also not really had to listen to each other in ways that we've had to over the course of the last couple of years. And the kind of the weaknesses and the naked underbelly of health in the United States has really been exposed. So we've got a lot of work to do, and I think we've had that aha experience now, and we're really trying to reach out and kind of mend some fences and heal some wounds and and pick up where we need to go. Public health has suffered dramatically during this time. The loss of confidence in healthcare and science has all been kind of, frayed, and we've got a lot of work to do to put ourselves back together. And I think that the work of the center is critical now. We kind of exploded in the last couple of years with requests from everybody, family, professionals, clinicians, attorneys, everybody about kind of what we needed to do. The long-term care settings were particularly hard for us in terms of being able to respond to their needs. Acute care, you guys were just traumatized over and over and over again, and the it's just the onslaught, the trauma was just unending, and you can take so much of that, and then at some point, moral injury happens, moral suffering, and that takes a toll. And I think we're kind of seeing that, kind of with the mass resignation thing. But professions in general, healthcare professions, teaching professions, I think have been assaulted, and we've got a lot of introspection to do, which is what I love about this exhibit, is that you go in and you sit and you look at this wish, and you look at hear these stories, and you see kind of the reflection and the depth of the thought that went into it and the expression. So it's a way for me particularly to kind of heal, and that's what we're really offering the exhibit for everybody to come down and see it, to heal from the last couple of years, because it has been a tough journey.
It has been hard, I'll tell you. I think ethically we had so many challenges from the hospital front when we had not enough beds and way too many patients, and you were having to make a choice. I mean, do I accept that transfer with COVID from an outlying hospital, or do I treat the stroke who's here or coming in from another hospital? Who do I? Because we can't treat everyone. U.S. healthcare is occasionally challenged by having too many patients in one area because there was a natural disaster, but this was this not so slow motion disaster that went across the U.S., having to send families hundreds and hundreds or even 1,000 miles away because that's where we had to find a bed for their loved one. Those were really challenging times, I think, and we're hoping they don't come back. But I think we were very stressed as a healthcare team across our country, really all simultaneously, and making those choices.
Crisis standards that we had in place made an assumption that there was going to be a very limited time where we had to worry about this, from hours and days maybe, but not weeks and months.
And it was clearly weeks and months.
Yes.
And we had 4 distinct waves of it, right? I mean, it wasn't like it just started. Yeah.
Right.
And I think the other major challenge is the work we asked some people to do, especially early on in the pandemic when we didn't know what was coming and we weren't really sure how to protect ourselves. And those tended to be African American, Latinx communities, and other folks who may not have the same access to health care. And yet we ask people to go be on the front lines and do things they were ill-equipped to do.
Yeah, that's that kind of naked underbelly that we're seeing, is that the folks who are least equipped and least able to respond in terms of protecting themselves were put on the front line and exposed in ways that in some respects we failed them. And I think that reparation of now that we've got to think about, how do we make sure that this doesn't happen again to us?
Yeah, how do we do right?
We're working right now. You mentioned the crisis standards, kind of this making decisions in the moment, and we're redoing that right now for the state of Kansas, and it has been an amazing project. We're weeks and months into it. We've got another month or so before we finish it, but I've got to tell, the leadership from the folks here at KU have been marvelous in being able to do it. We've got Kansas Health Institute that's working with us, and really the work that we're trying to do with the folks from the disability rights groups, to get them to hear their voices. Back to Marn's point about having it's time for us to hear the voices of those folks who are most vulnerable and least able to respond, and figure out what do we need to do in the calculus of next time in making sure that we don't lose them again, or we don't put them at risk unnecessarily. They're already at risk, but at least we can do what we can to protect them.
I'm reminded that so often on media you hear the voice of anger.
Yeah.
And it's sometimes a very shrill voice. We don't necessarily hear the voice of hurt and healing and what it means for all of us if we could just do a better job of taking care of each other. Hey, we're going to come back to the Art of the Wish event in just a moment and talk more with John, because this conversation could go on forever. Trust me, John and I have had conversations like that, and so it's always great to have you here in the studio. Hey, we're going to turn to Alexis in just a moment as well about some of those. Jessica Lavelle joins us from Studio B. Jess, how are you?
Hey, Dr. Stites, good morning. I do have a question for one of our community members and for our guest. What is your take on rationing care for unvaccinated people in hospital if hospital capacity is at a premium?
Well, I'll tell you, John, I was going to go there, so I'm glad this person did, because we've been hit with that question by our own team. I have this unvaccinated patient who wouldn't protect themselves, even though the evidence about the overwhelming safety of these vaccines is indeed overwhelming. And then I have a stroke patient or a heart attack I can't take care of. I mean, that's an ethical dilemma.
It is.
How do we do that?
Well, the first obligation you have as a doctor and as a healthcare provider is to make sure that we're not playing to the bias that we have inside of us. So all it takes is one story to find out why that person doesn't have a vaccination may be something that you weren't aware of. It may come from their past, it may come from their genetic makeup that you're simply not aware of, it may come from other kinds of trauma that they've suffered in their life. So I think the first thing to do is withhold judgment in terms of being able to do it. But the rationing part is really why you have crisis standards of care. You have other documents and other resources that you can draw on to say, okay, how are we going to make this decision in terms of being able to give this person the care they need? But the obligation of the patient, of the doctor to the patient is always the person in front of me. And so that resource that you have that helps you decide where it is that I'm going to spend my time and resources is something that we're supposed to be developing for you prior to the fact that you're faced with those kinds of dilemmas. And that's really what a crisis standard does, a document like that does. And triage, you know what that's like in terms of triage, and it's really that kind of a decision.
And I think we have to be really careful as caregivers when you go into any room that you don't judge that person.
That's right.
Because you're not in a position as a caregiver to be a judge.
That's right.
You don't know the story. I have had to take care in my time of people who have been mass murderers. I have had to take care of people who were white nationalists. I've taken care of people who had done truly onerous crimes. And at the end of the day, my job is to offer them the same level of compassion and caring that I offer to the priest or to the minister or to the people who we would think are just really good folks. Because at the end of the day, I'm a caregiver, not a judge. And I think when the struggle becomes when you are faced in the moment with making that choice and you're not exactly sure how to do that. And I think the answer to this, there really is no good way.
That's right.
I think what you try to do in that situation is to take all the things you have into account, all the resources, and make a judgment. Who can I help the most? What is the next right thing
to do?
I can do at that point.
It's called prudential judgment. It's an important quality and it's an important value that we have in healthcare, and it's one that doctors are faced with many, many times during the course of their career.
Hawk, welcome in this morning, brother. How are you? Medical Director of Infection Prevention Control, Dana Hawkinson, also known as Hawkeye. I don't think he has another name, really.
That's right.
How are we?
We're doing pretty good.
We are doing good.
Yeah, we were up closer to 10 for active infections the last couple days, I believe. Right now, 5 active infections, 2 in the ICU, none on the ventilator, 16 in that recovery period. Again, still cases are continuing to climb nationally, hospitalizations as well. Again, I think most of that is driven by the Northeast there currently. Kansas and Missouri, I believe, still are decreased in their rate of hospitalization for now, so that's a good thing.
Yeah, I think the rate of hospitalizations is still down across the country. We see the case counts starting to ebb up in the Midwest, and we follow that New York Times heat map, and if the guys can bring it up for just a minute, but sorry, I didn't warn you about that one, team. But you see it's starting to light up a little bit again, and I think it's just a sign that we're getting more of the BA2 variant, the BA2.1.12 variant out there. And what it tells, it's an interesting story because hospitalizations haven't risen yet, and I'm going to hope, and I'm going to bet they aren't going to rise like they have in the past. Hawkeye, news coming out yesterday, 50 to 60% of Americans have had COVID at least, and then with that, and other predictions from the CDC saying it may be 3 times that number.
Yeah, I think we'd have to agree with that. I think that's consistent with what we've seen. You know, again, there are caveats with these studies. They are just serological studies, meaning they are just looking at antibodies. But I think if that is consistent with what we've heard, you know, as far as since the pandemic, how cases in general around the world are probably 2, 3, 4, or 5 times higher than they have been. Death estimates as well. So I think this is reasonable, and I think this is one of the reasons why we are hoping and believing that the hospitalizations will not occur as they did in the last surge, even if we start to see a further surge going forward.
I think that's right. If you look at that heat map, I think we've got it popped up. Sorry about that, guys. Yeah. So look, last week we talked about this heat map on open mics, and it was almost all yellow except for a few spots. Look at it today. There's a lot more orange. There's a lot more dark orange. You know, we're going to see another major surge. And here's this challenge to us. This is with very low public reporting now, because people are often reporting once a week from the states, from their data. Lots of places are not doing testing anymore. They're relying on at-home testing. Lots of people can't afford to get at-home testing, and I know the government says we'll give you a few free tests, but that lasts about a week, and then it's gone. And so, you know, the reality is these numbers are increasing across the country. Remember, the rules of infection prevention and control, what do? They travel with you wherever you go to keep you safe into this moment and every day long.
And I think it is interesting. You know, I still don't know that I've ever had it. I certainly had my antibodies checked in December prior to going home, believing that I probably had been exposed or had been infected, and I didn't. I probably should go and get my antibodies checked again to see if since that time, with the boosters and all that, if I've ever been exposed or infected and didn't know about that.
You know, and there's lots of discussion out there right now about natural immunity and vaccination and which is better. The reality is vaccination is much safer, especially for those who are at-risk categories, those who are a little older, like me, those who are, and probably John, sorry, John, and those who have underlying diseases. And because the one thing we don't know yet is the risk of long COVID. It's still said that 30% of patients who get COVID may have long COVID. And the simple challenge is we don't know what that's going to happen. We don't know what the story is around Omicron.
Yeah, no, I think that's a good point. I think you are exactly right. You know, the safest way to immunity is through vaccination. Can you get some hybrid immunity, if you will? That's what they're calling it, where you get some immunity to those other pieces of the virus that you don't get from the vaccine. But we also know there was a good publication in New England Journal of Medicine a couple weeks ago showing that people who had never been vaccinated and had Omicron only had antibodies, neutralizing antibodies to Omicron. But those that had been vaccinated and then infected with Omicron, they also had neutralizing antibodies to BA2 and all those other variants as well. So, you know, vaccination continues right now to be the healthiest, the safest way towards immunity as well. So I think that is another important thing to note.
It is. We probably need to talk more and more about that, but we're going to go now. We've had some background in the Center for Practical Bioethics. Let's talk more about the Art of the Wish event. And for that part of the story, we head back to the Crossroads and talk again with Andy Newcombe and Marn Jensen, who are the artists taking part in the show. Okay. How we got there? How did you all get involved with this project? How did it even come to you?
You want to take that one?
Sure. We both work for a Kansas City corporation and were awarded a sabbatical and were given 6 months to go and do this self-directed project. We created the project and had a smaller exhibit about half the size of the one that is here at the Leedy Gallery, and we had an overwhelming response. And at that time, we were introduced to the people at the Center for Practical Bioethics, which are now such great friends, and we are such advocates for the center. And so we will always have that connection with this amazing organization. So we feel very fortunate. It's one of the many great things that's come out of this effort for Marn and I both.
Right, and when we had this opportunity to do this project, Andy and I both had our whole life a real love and affinity for older people. And we shared this, we're good friends, and we decided that we were going to take this passion of ours, give some time back to the elders in our life with these conversations and do something that would unfold into the community. So that's how it was born on a personal note. And we were also dealing with situations, medical and caregiving situations with our own mom and dad, which really was the impetus for this work.
It's really what moved us forward. We just felt like for both of us that we had to do something positive, which what seemed like a very difficult and hard road for our families when one of our parents each lived with Alzheimer's for several years. So it was a way for us to do something creative and to speak to so many issues in a positive way.
That is just such a remarkable story. Marn, go ahead, Marn.
I was just going to say that we are standing in this section that we were able, through the Practical Bioethics folks, helped us get a grant through KU Med, through the Frontiers group, a Frontiers grant, which allowed us to interview elders and caregivers and people in healthcare to focus in on the question of what are your wishes for your doctor, your caregiver, anybody in this sort of healthcare world, which was really a special focus for us. We got it in 2019, so we were able to do this, kind of limp through it through COVID. But we had some great conversations around this topic, which would obviously be specifically interesting to your community as well. So that's where we're standing. We have these pieces here that are specifically in that realm.
Yeah, do you think you could just show us and tell us a story about one or two that are your favorites or mean the most to y'all?
Sure.
Go ahead, Marn.
Well, one that keeps getting, we have, Andy just showed you the large piece and a lot of large, big, but this one that is getting some conversation is around this little teeny tiny piece of work, which I'll just read you the wish. I wish every caregiver knew the power of eye contact. It is so simple, yet it makes a profound difference.
I believe that, boy, that's so true.
Yeah. And this was actually from a retired physician, so that meant even a little more. But in my personal experience, this played out so often with my mom and dad. I would go to an appointment, and the eye contact was given to me, the younger person, and not to the patient who really needed that moment of connection. So this one is a very special piece to me because, again, if you can take one thing, one or two little gems from our work and put it into action, that's when we know we've had a win. So eye contact.
Eye contact, I love that.
So it's funny too. I mean, all the senses really came out in this section. So the eyes, and then that reminds me of this one here that I did is about listening. These simple acts. The wish is, I wish doctors, caregivers, I wish they would remember to take a minute to stop and listen. Listen hard. And again, we're so busy. We're all so busy running, doing everything. But again, to hear from an elder, there's just that moment of really hearing them makes a huge difference. So again,
it does.
Eyes, ears, simple. And then Andy, this led Andy to think of one we wanted to show you too in this theme of...
Right. And so,
of the senses.
It's kind of the Holy Trinity here, but we come over to this piece, and this was not from an elder in the healthcare community. It was from a minister, and this wish was, as a minister, when I am part of the process at the end of someone's life, I always ask if I can hold the hand of the one who is dying. I have never been denied. I wish we all fully understood the importance of connection, of human touch. And I have to say, but this is one that we did hear from the medical community and from elders, and it's just that importance of appropriate touch, a hand on a shoulder, grasping somebody's hand at the right time. it is maybe the only time that that elder has had human touch in a very long time. So I think, again, the idea of really looking in somebody's eyes, really actively listening, and then using appropriate touch, those are all so important.
Yeah, those are great stories. And so I'm going to be once again joined by John Carney, President and CEO of the Center for Practical Bioethics. John, how much longer is this art going to be on exhibit?
Well, it runs through May 27th.
Okay.
We have a big event coming up on the 12th. Actually, tonight we've invited medical students for a preview.
That
so
is
hopefully
cool.
that'll happen tonight. Tomorrow night. And then on the 12th is our big event, which is a ticket event. You can get information from the center's website. And Martin and Andy will be there for everybody. And then on the 24th, we're going to have a workshop in honor of Joanne Berkeley, the Berkeley Symposium we do every year. And we're going to invite about 150 folks to come down and actually meet again with Martin and Andy and just talk about things. That's a free event for the community to take their ideas and say, what can we do creatively, taking this message and this experience and reconnecting with people. And then on the 27th, I think it wraps up. And I think we've all got hopes that maybe there'll be some places for some of this art to go.
Oh, it's got to go. It's got to go. It's so cool.
Yeah.
I mean, that part about the two hands holding, is completely true. I've worked the same nurse for unfortunately for her for almost 20 years. And the first thing she always does when she goes into any patient's room is she takes them by the hand. And it's such a meaningful gesture, I think, to the patients. And so is this artwork for sale?
Not yet. No, they're actually, Martin and Andy, part of the event is they're going to donate each a commission piece that they're willing to offer as a raffle. So that's one way we're raising some money. So in that sense, you can get it. We were thinking about auctioning it off, and some of our work, the folks who are volunteering to do it, said, not everybody can afford a $10,000 auction piece, but everybody can afford $20 for a ticket. So we're doing an auction a raffle for both of them to do a piece. So we're going to do that. And then beyond that, I'm not really sure. It's really up to them. It's their art. But I think both of them and all of us would really love to be able to see this show go on the road.
Well, it needs to be a traveling show. I mean, once you see it, you're going to understand. There's a message and a story here that is very important and very relevant, especially to how we reconnect after the last few years of disconnection. How do you reconnect? I think this show really, that there is a connection that happens here, and I think that's incredibly
I'd really like to
important.
make sure your viewers today understand this is not a sad place. This is
it's not.
A wonderful healing. I mean, just sitting and looking at these pieces, there are something. Now I got teary on a couple of them, but it really is it's a marvelous, absolutely wonderful exhibit.
And it's easy to see it as a story of death and dying, but I think it's so much more than that.
Oh, there's a lot
It's about
there,
the wish of folks who do face the end of their life. And you didn't have to be an elder. My mom died when I was 19. She was 52. She had lung cancer. And I remember she looked at me as she was on her last. She said, "I want you to grow up to be as good a man as your brother." And and it's like, oh. And she knew death was there at her door, and she wanted me to hear those messages. And this, to me, is a message, and I love that Make-A-Wish.
I did fail to mention the Leedy is open Thursday, Friday, and Saturday from 11 to 5, and obviously first Fridays in May they'll be open in the evening. So those are other times when the
cost to the exhibit.
No, there is not. Get during the day, during the Thursday, Friday, Saturday, and then the evening ones, there's no charge. And then the one tonight, the previews we're doing, they've also generously donated the time for them to be open. So
Lady Voca Studio down the crossroads.
Yeah.
That's a good place to be. Jess, let's see if there are questions or reporter questions out there today. Hey, Jess, we don't hear you. It's the mute button. Just a mute button, just saying.
Guys, can you take me off mute?
Now you're off. We hear you now, Jess.
Guys, got to take me off mute back there. Okay, so question from Joellen. Any thoughts on why our neighbors to the west in Colorado are seeing a higher heat on the map?
Yeah, great question. I think what happened is, I'm going to speculate, Hawkeye. You always hate it when I do this, But tourism and industry, and it's the middle of the ski season when their slopes started to increase over spring break. I think that's the story. They started to escalate because there were a lot of people gathering in places, and sometimes before others did, and there's a lot of travel that comes in and out of Denver. So I think that's probably part of the story.
Yeah, absolutely.
And they also had more public reporting of data.
Yeah, I think both of those are key points too there, and it's very as Dr. Stites pointed out earlier, it's very difficult now because of lack of public reporting, home tests, and all that. And so these are two other things as well, that tourism industry, maybe more robust public reporting of that information. Maybe more people are going to clinics to get tested. So there are a variety of reasons there for sure.
All right. Isaac may have just missed this one. He says, I'm assuming the exhibit is open on First Friday, as in May 6th.
It is open on First Friday, May 6th. Yes. Go head down there and see it. That'll be cool. If you don't want to do that, you can go to the Shave to Save event and watch me cut all of this off, after which I will look like a Ferengi from Star Trek because I have approximately very big ears and kind of some funny-looking forehead. Some of you might want a picture of the Ferengi we can pull up, and then you're going to see what I'm going to look like on May 6th, Shave to Save. Don't miss it. And the cool thing is you can go right over to see the art at the art of the exhibit because they're sort of co-located in the same general area, so very cool.
Your bald head will be a piece of art in and of itself.
No, yeah, well, yeah, it won't bring much.
It won't bring much in. Well, we're looking forward to the Shave to Save event. Okay, question about what's the latest you've heard on nasal spray vaccines?
Yeah, that's really in development, Hawk, and we're expecting to see some data, I think, in June, July of this year about the success of that. There's all sorts of things. There's the patch that people can wear with multiple prongs that kind of inject over different periods of time. There's the nasal spray vaccines. There's some talk about an oral vaccine. So lots of different things we were talking about. I think they're all still, I would still say, that's kind of the deal, but there's more to come about it.
Yeah. I think these are all good things. Hopefully with that nasal spray, we can get more mucosal immunity, meaning in that area where the nasal spray goes. Hopefully that will help prevent infection more. These are all very exciting things. The bar is going to be set very high, though, Steve, with the mRNA vaccine effectiveness. And so that's probably what a lot of these things will be compared to. But I think you're right. There are new things coming out. It should be exciting, but we haven't heard any more from the nasal spray since that initial press release.
Yeah, I think it'll be interesting to find out more. Remember that the influenza vaccine is often about 50% effective, and this year is 16%. Now, over a 2-year period, the mRNA vaccines have maintained 85 to 90% effectiveness against severe hospitalization and death. If you're in medicine, you'll appreciate it. If you're not, it's hard, but that is an uncanny, amazing, miraculous number. And gosh, they are a work of art, those mRNA vaccines. Jess?
Dr. Hawkinson, okay, 'tis the season. Deb has a question for you specifically. Have you heard of the tick-borne illness alpha-gal?
Yeah, that is something where if you have a tick that's been feeding on you, after that you start, I believe, becoming, or you're somewhat allergic to red meat. But, I know that some of our allergy colleagues, Dr. Gear and Dr. Love, do take care of those patients, but yes.
Okay.
If that was a question.
I remember doing a story on that, the red meat connection. It was kind of
and it's becoming more prevalent. I think there's more recognition of that, certainly. So as we've seen with a lot of these diseases, they are becoming more prevalent for one reason or another. Maybe more population going out, getting into those situations where they have ticks, but also more recognition of that disease as well.
Dr. Stites, I'm going to send it back to you for final thoughts.
All right, excellent. Well, we're going to go around with our guests and talk about their final thoughts. John, can I start with you?
Sure. I want to thank you for the opportunity to be here. The partnership
thank
with
you for
KU Med
coming.
has been a great gift to the center at all the medical schools here in town. We're honoring Dr. Brian Carter on the 5th as part of this event as well. Dr. Brian Carter is a bioethicist, neonatologist from Children's Mercy, runs the ethics program over there. He's been working with us for 15 years. We benefit so much from the relationship with the medical schools in Kansas City, including KCU. So we really rely so much on you guys. And give yourself a gift. Come down and see the show, especially come on the May 12th. Have a chance to meet the artists, support the work of the center, maybe win that piece of art that Marn and Andy are going to be able to donate to some lucky winner. So anyway, we really appreciate the support and the great contributions that all the community makes to the center, and it keeps us being able to do what we do every day.
Yeah, it is. It's a great story. And one of our older faculty, Dr. Mani Mani, one of our original burn surgeons, I think his wish is in that exhibit, if I remember correctly.
Yeah, well, I think so, yeah.
Yeah, and those guys, I know. When I was a young physician here at KU, Dr. Mani Mani, who had one of the first burn centers in the country, here in our hospital, I got to know him. Pretty remarkable story, pretty remarkable man, and to see his wish down there meant a lot. So, Andy Newcombe, final thoughts.
Thank you. I think I will leave with this piece over here. And this wish came from a medical student. And she said, as medical professionals, we are asked to keep pouring water into our glass so that we can sustain others in need. I wish I knew how to keep the glass full. And what I would say to that, and what I said in the piece when I wrote the statement that went with it, is it's really the responsibility of all of us in the non-medical world to corporately and individually work with the medical community and to support them and help those individuals find the way that they can stay inspired. And I think for Marn and I both to be able to do this exhibit and work with practical bioethics, it's a way that we want to support the medical community and let them know that they're not alone, especially in today's world.
Thank you for that.
And I just want to add,
Jensen,
I'm so
please.
glad. I'm so glad you brought up Dr. Mani Mani, because he was one of our original wishers, and he has participated throughout. And we have learned. It's just reminding us both of how much we've learned from all of these people, and how fortunate and lucky we are to be doing this with you all today, and to meet you. And cheers and thank you for all you all do back for the community.
Well, thank you all. The Art of the Wish, I think it's a beautiful, beautiful exhibit, and I urge everyone to have the opportunity to take the opportunity to go see that. Dr. Hawk.
I would just echo those comments from our guests for sure. I think these are important. As we, can try to think about things other than pandemic and COVID, I think these are very important things. So it's certainly just going to repeat that and echo what we've heard.
This is what I know. Recovery takes time. Mm-hmm. It does take time, and recovery is hard. And I think the Art of the Wish, I think the work of the Center for Practical Bioethics, it is about connecting people and recovering. And as we journey forth, not knowing quite what is in store around the pandemic, what we have to do is find a little bit more of our heart and a little less of our hostility. And if we can do that, this world can be a much better place. It doesn't take all of one, but it does help if we can find a little more heart, a little less hostility, and we can all have a little better wish. Jess, I want to throw it back to you. There's some morning headlines we haven't covered yet.
There is. The focus of this morning's headlines, Dr. Stites, is none other than you. Joining us now in studio is David Worm, Executive Director of Mid-America Regional Council, and Janae Hanslick, a commissioner in Johnson County. They are here to present you with an award. So I'm going to let them take it away.
Thank you very much.
Okay. Time. What? Hello.
Surprise.
Hi, David. How are you?
It's good
We'll
to see you,
have
Dr.
words.
Stites. we knew you'd be thrilled, so we're doing this. I am David Worm for your audience. I'm the director of the Mid-America Regional Council, and our organization is an association of all the local governments in metropolitan Kansas City. We bring together cities and counties and lots of community partners, including the center and hospitals and schools and universities, not-for-profit agencies, for a purpose, and that is to help our metropolitan community come together and to be more effective by working together. And each year we give an award, a regional leadership award, to a handful of individuals and organizations who have demonstrated exemplary leadership and who have helped us become a stronger community by working together as a metropolitan community. And this year, we are giving our awards at our annual meeting on June 10, and Dr. Stites is not available to be there. And so we just want to be here today to say thank you in person, how much your work has been valued and appreciated for bringing together the medical leadership of this entire region and helping us coordinate critical care, but equally important, to inform and educate and support the general public and decision makers through a very tough 2 years. It's been extraordinary and we appreciate it. I'm here today with the Vice Chair of the MARC Board of Directors, Commissioner Janae Hanslick of Johnson County, and she is going to present on behalf of the elected officials who serve on our Board of Directors our Regional Leadership Award.
You guys are not.
Dr. Stites, it is a true privilege for me to be able to present this award to you on behalf of the MARC Board. And there are just so many wonderful things that you've provided to our community over the past 2 years. You're providing reliable expertise from the medical perspective, has provided comfort and guidance to many, many people in our community. As an elected official, I especially appreciate your bringing together all the chief medical officers to give us information and guidance. But I have to say, most of all, I have appreciated personally your humor and your positivity. There are days that I just had to watch you so that I could be ready to do what I had to do. And you've been a true gift to our region and our community. So
Thank you
please
very
accept
much.
this gift
Okay.
and
First of all,
our
can I
appreciation.
I got to give her a hug. Thank you. Thank you very much. Okay, it's good. Do I get the final word now?
Yes, yes.
Okay, first of all, thank you very much. And this is a surprise. And this morning is a surprise. I didn't know about this. But I said I can only accept it on behalf of myself, but also all the chief medical officers in our region, and Doc Hawk, and our entire team here in this studio. Jill, Logan, Anthony, everybody, Bob, Cliff, everybody's back. This is a team effort. It is always a team effort. No one person does this. And I work with an amazing team. I am granted license by Tammy Peterman and Bob Page to go make a fool of myself on a regular basis. And I can't tell you what wonderful leaders they are to have allowed us to do this. Back at a time where we had to question when we started this program whether or not we were right to step into it. And God, were we right to step into it. But all the chief medical officers in our community, we are at times fierce competitors. And at times we are fiercely loyal to the cause of saving lives and saving people and trying to make life better. And so really it was no one person, it was all of us, and it was all of our CMOs from across our community. And I accept this award on behalf of everyone and appreciate the kindness, but also the knowledge that it represents the work of a great group of people who have come together and tried to tell the story as best we knew it. We always knew we were building the airplane while we flew it.
Yep, because I'm going to interrupt you right there because you are the motor or the engine of that airplane that we are building here to give accurate, evidence-based medical information.
Well, you guys are all way too kind. It always takes a team, and what I would say to you as we go forward is that, kind of we said for a moment ago, if there's anything we've tried to do, I keep coming back to this one thing, the intersection of faith, hope, and science. The faith that allows us to stay true to what we're trying to do work together, the hope that we can have a better day, and the science that has delivered a better day in the form of vaccine and effective therapy. And then people like Mark, who have done an amazing job of pulling together disparate communities throughout our region and helping them share in the way to protect all of us against COVID. We've always said that COVID doesn't care about what color you are, what city you're from, what state you live in. It doesn't care who you are. It doesn't care about how much money you make. It just wants to find a place to attack. And Mark's leadership is amazing because of the way they've helped us put this community together during these hardest of times, and I think that's part of why we have been successfully and we have survived it as well as we have. So a special thanks to the Metropolitan Area Regional Council, to all the team who is here, to all the CMOs across our community, and to all of you for listening. At the end of the day, we do this program for you, and we do it with the idea we're not going to flapjack. We're not going to flap our arms and jack with the truth. We're going to talk about faith, hope, and science. And we're going to talk a lot about hope. And we're going to show you how science can get us the hope to get us through to the next day. Thank you all for being here this morning.
Well, thank
you.
We so appreciate
Thank you.
John Carney for the center, and to all of our friends out there for the Art of the Wish, and to all of you. Thank you. You all are the best. We'll see you tomorrow.
Dr. Stites, I've got one quick headline I'm going to share, but it's hard to follow. This is hard to follow because now I have to give like backed up traffic report after you just said those beautiful words. So congratulations, well deserved. We've all been honored to be your, I'll call us your backup singers for the last couple of years. So thank you for leading the way. We appreciate you always. Well, if you're heading to our health system anytime soon, we do have an orange barrel alert for you. However, work of the expansion project of our emergency department is now underway. So as we all know, the ER has been very busy over the last couple of years, and this is just another example of how the health system is growing. So it is good news. It will include more exam rooms, trauma rooms, and more rooms to help those with psychiatric issues as well. So this means part of eastbound 39th Street near Cambridge, that's on the north side of our hospital, that is going to be blocked off as we begin this work. But when it's complete, there will be 2 convenient lanes for patient drop-off outside, and the ER, though, will remain open during this 2-year project. So again, thank you everyone for being with us today. Congrats, Dr. Stites. Don't forget you can catch us anytime on Facebook, on YouTube, on Twitter. We'll see you tomorrow. Have a great Wednesday.
Coming up tomorrow on the Morning Medical Update. Keeping the S word out of you and your family's mouth. Do you know how much sugar is really in your favorite food or drink? Coming up Thursday on the Morning Medical Update. How to avoid it and burn it. That's at 8 on these social media channels.
I'm Alexis Del Cid on the next All Things Heart. It really lies on the mom to do it because nobody else can. How breastfeeding is connected to heart benefits for mom and baby. Thursday at 10.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.